My name is Dr. Ryan Lee. I am a practicing dental oncologist, which means I'm a dentist that works with cancer patients. Today, I'm here to talk to you about head and neck cancer and how dentistry and dental oncology may be areas of focus for you because of your cancer experience. In a moment of just honesty and maybe a little bit of humility, if I can say it that way, I really have not very much to do with the actual treatment of the disease of cancer. Other incredible healthcare specialists are doing that. I just happen to have the privilege of sometimes finding a cancer early on and often rebuilding a patient's mouth using implants and other dental treatment for survivors at the end of their cancer journey and hopefully for many years after. A dental visit to any dentist or hygienist ought to involve a screening of obviously not just the teeth, but the tongue, the gums, the inner cheeks, the tonsils, the back of the throat, in and around the lips, areas under the tongue. And I can assure you every dental professional who goes through clinical medical dental training is taught of the importance of really cancer screening, including feeling the lymph nodes in and around the neck, the back of the head. And so what's generally called head and neck cancer screening, oral cancer screening. If you are experiencing any changes regarding your teeth, your gums, your throat, anything around the jaws, and even the lymph nodes underneath your jaws and on your neck, I would pay attention to it. And I mean this for anybody, but especially for patients who've completed cancer treatment or patients who have cancer history in their families. Things such as difficulty swallowing or dry mouth or painful lesions, bleeding from the gums, from anywhere in the cheek, the lips, the tongue, pay attention to it and bring it up to the dentist the next time you go. And certainly if it's something that doesn't go away after a week, and if there's any changes in color, if something feels swollen, really it should be looked at and addressed sooner rather than later. Where the dental oncologist like myself comes into play is that we will do cancer screenings with proper clinical exam, just my eyes with magnification, but we'll also use adjunctive devices, specialized types of light that will show us if there are suspicious areas of lesions, for instance, on the side of the tongue or in the back of the throat. And that can often lead to a consideration of a biopsy, which involves just a very minor oral surgery procedure to take a piece of tissue and to have that be sent to a pathologist so that it's analyzed under a microscope. And so that gives us information regarding what that lesion was. Sometimes the pathology report comes back positive, and so that can lead to either further biopsies or a referral then to these amazing surgeons, head and neck oncologists, or others that can definitively resect or treat that cancer. A good example is a patient that is about to start radiation therapy. They're about to embark on a 6.5 to 7 week journey, and we don't want to have dental problems, jaw infections prior to or even during radiation. So we're asked to provide a dental clearance. And so we then quickly have to assess the patient and treat the patient relatively quickly so that their chemo, radiation, and other modalities are not delayed. Typically, patients are referred to us from cancer centers or hospitals, mainly from oncologists, nurse navigators, and other specialists that work with cancer patients. A good example is a patient that is about to start radiation therapy. They're about to embark on a 6.5 to 7 week journey, and we don't want to have dental problems, jaw infections prior to or even during radiation. So we're asked to provide a dental clearance. Patients who've completed cancer treatment, and certainly patients who are undergoing cancer treatment, have two broad categories of complications. One is short-term, the other is more longer-term. The short-term complications are, for example, painful ulcers, bleeding gums, dental pain, and just discomfort in and around the teeth, the gums, and the jaws. There's also longer-term complications. One prime example that we are always concerned about is a condition called osteonecrosis, or osteonecrosis of the jaw, ONJ, and it means death of bone cells in the jaw. So osteonecrosis of the jaw is a relatively rare but complicated problem, a complication because there isn't really a clear cure for it. Oftentimes it's conservative management, and we wind up really carefully removing parts of the jawbone to really clear the body of that problem. Every time you literally go for a checkup and a cleaning, I recommend that the patient tell the dentist and the hygienist, Dr. Smith, I had radiation 10 years ago. I just want you to know that. Even if you have no pain or symptoms, still something worth mentioning, because it's much better to catch any complications and prevent them, certainly, than dealing with them later. In general, within the first year after completing chemo or radiation, the recommendation is that the patient come every 3 to 4 months. We want to monitor things like gum disease, jaw infections, dental pain. But there's also the risk of dry mouth, which is called xerostomia. Going to your dentist every 3 to 4 months instead of once or twice a year might be the difference in catching things early. And depending on the risk of that patient's dental condition, they can go back to once or twice a year at the recommendation and discussion with the dentist. Typically, patients are referred to us from cancer centers or hospitals, mainly from oncologists, nurse navigators, and other specialists that work with cancer patients. Other times, it's really a word-of-mouth self-referral that we often see because the cancer community is a very tight-knit, close, well-educated group of patients. And so we have a lot of patients that just find us and come for their various dental issues and care that they need. A patient who lives far away from a academic hospital or a cancer center may have difficulty obtaining dental oncology services. I recommend that patient go to a dental office and clearly explain, his or her cancer experience and the background medical history. The dental team, like any other part of the healthcare system, should be able to understand when they can provide the care there in the office or when to refer out. If you or someone you love is affected by head and neck cancer, remember that you're not alone. Together, we're made of more.